Now it's my honor to introduce today's speaker, Karen DeMairo, Vice President of Education, Support, and Integration at LLS. We're excited to hear from Karen and are confident that you'll gain valuable insights from her presentation. Thank you, Karen. Over to you.
Thank you, Belinda, and thank you to the Alliance for having us here today. I'm going to share my screen. What happened to my slides? There they are. Okay, and hopefully everybody can see my slides. So again, my name is Karen DeMairo. I am the Vice President of Education Support and Integration. And what I'm going to do today is talk about the Leukemia and Lymphoma Society, our overall mission, and some of the education and support services that we provide. So first, our overall mission basically is to cure the blood cancers, but also to improve the quality of life of those patients and their families. We do that through a number of ways, through research, advocacy, and then patient services. What I'm going to focus on today are the patient services that we provide. So I'm part of the Education Services and Outcomes Research Department. And that includes a number of different teams, as you can see here. So we have our National Patient Professional Education, which I lead, our Information Resource Center, our Nutrition Education Services, our Clinical Trial Support Center, and our Patient and Community Outreach Group. All of our teams work together in an integrated way to make sure that we're servicing patients and their caregivers, as well as healthcare professionals, in a very cohesive and comprehensive nature. And as part of all of that, we also capture data. We report on the data. We look at what research is being done. We sponsor research, evaluate what's happening so that, again, to best service the patients. So this is kind of a very general overview of the education and services and resources that we have available. You can see that we have various different ways of educating patients and supporting them. And I'm going to go into a lot of this individually in the next couple of slides. We do this through providing information on disease, treatment, clinical trials, psychosocial support, nutrition, and then survivorship and financial issues, and as well as communication skills. Some of the areas that we focus on now as priorities are survivorship and everything that goes into that. And we routinely take the stance that survivorship starts at the time of diagnosis. While not everybody sees themselves as a survivor from the beginning, we always refer to survivorship from the start. Underserved groups, another big priority of ours to make sure that we're reaching all patients that are diagnosed by a blood cancer, even those that are hard to reach. And that includes all of the rare diseases such as Erdheim-Chester. And then clinical trials. Clinical trials is another area that we have a very big focus on. We know that through trials, that's how we find the new treatments for all of these diseases. So we always want to make sure that we have the resources available so that patients are aware of trials that are there, but also have access to those trials. And we do all of this, as I said, for patients and caregivers, but we also do all of this education and outreach to professionals as well. So the three services here are one-to-one personalized support. I'm not going to go into detail on these because in the coming months, the respective leaders of these areas are going to present to you and really do deep dives into those departments. But I just wanted to give you a high-level overview so you know what's coming. So the first is our Information Resource Center. This is what some people refer to as a helpline, right? But it is staffed by highly trained oncology social workers and nurses. And what they do is respond to patients and their caregivers at the time of where they're at, right? So if they've been newly diagnosed, they may come to us and ask for information on the diagnosis itself. Or maybe they've been given options of different types of treatment, so they want to go over the treatments. Or maybe they were diagnosed 3 years ago and now want to talk more about late effects, or they're having financial issues that they want to deal with. Wherever they are in their journey, that's where our specialist will meet them. They can do this through the phone, but they can also email, and we also have what we call an answer chat on the website. The IRC is open from 9 to 9 Eastern times, Monday through Friday, but you can also leave messages over the weekend and on off hours. The other area is our clinical trial support center. So here we have 12 full-time trained nurse navigators, all with experience in oncology and in clinical trials. And what they do is they will provide personal navigation through the clinical trial process, starting with taking information from the patient's full health medical review and stuff. They will look for trials that are appropriate for the patient. They will talk to the principal investigators, as to what the needs are, go through any criteria that the patient may or may not meet. They will look at barriers and gaps, right? If the patient has a financial barrier to getting to a trial, they will work with them and very often hook back up with the members of the Information Resource Center to make sure that we can help them as best as possible. While we always want to find trials that are appropriate for every patient, sometimes in the end result, that's not what is the most isn't the most important, right? Sometimes the patient is already on the best treatment for them. So there may be a patient that goes through this process only to find out they're getting the best treatment possible at this time. But at the end of the day, these nurses will make sure that the patient walks away with all of the appropriate options for them, that they can then go and meet with their care team and present a list of trials or options for them. We do not send them over to clinicaltrials.gov to go do their own research or anything like that. These nurses are doing all of that for you to take care of it. The other area is our Nutrition Education Services Center. So we have 2 registered dietitians that will do nutritional educational consultations with patients or their caregivers on a one-to-one basis. The unique thing about this service is it's for all cancer diagnoses, not just blood cancer. So anyone with a cancer diagnosis can get a consultation. As part of the center, we also have a number of different resources, booklets, videos, podcasts, a number of things, all about nutrition while you're going through a cancer diagnosis. So the IRC and the CTSC, as we call them, the Information Resource Center and the Clinical Trial Support Center, both have bilingual staff. And then all 3 of these services have access to a language line and interpreters, so that this way we're best able to service as many patients as possible. So now I'm going to go into a number of the other types of services we have, starting with our support services. So we have what we call online chats. So these are weekly support groups, okay, that are done specifically through the computer. They are moderated by an oncology social worker, a licensed oncology social worker, who, when you type in your question or your comment or whatever it is, that social worker sees it first. And the social worker then has to push it through. The reason we do it this way is, one, in case a patient or participant, because we do have a caregiver chat, wants to only talk to the moderator, and they can do that on the side. Also to make sure that nothing inappropriate is being posted. We're very careful about what information is being transpired over these chats. And again, really for the safety and well-being for all of our participants. We have chats in all of the major blood cancers. We have a caregiver chat. We have a young adult chat. And then we also have one on Friday afternoons, which started out basically because of people wanting to talk about issues related to COVID, but then turned into more of a very kind of a general chat for patients that were diagnosed with a blood cancer, and is continued at this point. We also started this past August for one for veterans. And then, as I said, all of the major blood cancer groups have their own chat. We also have local family support groups. So here, these are run in conjunction with our field staff, our patient and community outreach managers. And some are in person, although again, ever since COVID, many of them went virtual, but these are done more, they're local. So you're basically going to find people to interact with from your local area as opposed to the online chats, which are national and across the country. Again, they are moderated and facilitated by oncology social workers, nurses, PhDs. We try to have at least 2 facilitators for every support group. Then we have our Patty Robinson Kaufman First Connection program. So this is a peer support, as many, people will say they've been there, done that type of thing. And here we have volunteers who have either been diagnosed with a blood cancer or are a family member of someone who was diagnosed with a blood cancer. And they have become trained to be a volunteer to basically talk with other mostly newly diagnosed patients and caregivers. But again, sometimes people aren't ready to talk to someone in the beginning, which, many of you, I'm sure, know this. So even if someone was diagnosed a year ago and now feels that they're ready to talk to someone else who's been through a similar experience, they can call us and we will arrange for a connection. The connections are mostly done by disease and by treatment, but we always want to make sure that we're meeting the need of the patient. So if it's a patient who was diagnosed, say, with Hodgkin's disease, but the disease is not what's important, they want to talk to someone else who had young children when they were diagnosed and don't care what the disease was. So we may then hook them up, say, with someone with CML who was a young parent at the time of the diagnosis. The intention here is to always service the patient as best as possible and to give them the peer support where they really want it. So we have a lot of conversations with them before matching them and then do what we can to find the best match possible. And then we have our LLS community. So this is our online social network. Patients and caregivers can go on there and talk to each other, ask questions. If there are questions that are more clinical and they need some kind of disease information, we have our information resource staff that are always available to answer questions. We also have we have 4, I think it is, ambassadors who work with community and are constantly going in and monitoring the groups to make sure that people are getting their questions answered. And if they need any help or need referral someplace, that we're taking care of that. So then we also have a number of educational resources and materials and programs. So I'm going to start with what we refer to as the print material, right? So we have booklets, we have what we refer to as fact sheets, and you see the Erdheim Chester fact sheet right there. Those are usually anywhere between 7 or 8, even up to maybe 15 pages. Basically what that is are their topics that didn't warrant a whole booklet, but needed to have their own space and their own resource for people. We also have what we call fast facts, and those are usually just quick back and forth sheets. We have guides. So the guides right now are versions of the disease booklets, but in a somewhat of a lower reading level, but also not as detailed and comprehensive as the booklets. So say, for instance, an AML booklet. There would be a booklet which has all of the information, all the testing, all the drugs, everything from soup to nuts in there. Whereas the guide will have higher level information with not as much detail. A lot of times what we do is we suggest people get the guides for, say, for family members who want to know some information, but not everything. Okay. Those are all available on print and online. So if you go to the website, say for the Erdheim Chester fact sheet, you can either read that online or you can download it yourself, or you can order a copy and we will send it to you. Then we have our programming. So here it's both patient and professional programming. We also have, just to mention, that we have some fact sheets that are written at a higher level specifically for professionals so that they have something also. So then our education programs. So we have both local and regional programs. Here you see a picture of the Blood Cancer Conference. We do basically 11 blood cancer conferences a year. One is a national one that's done virtually. The rest of them in 10 different major cities. And basically they're like an extended half-day program. So they'll start, 9, 10 o'clock in the morning, running till about 2 o'clock in the afternoon. There's usually a keynote speaker, a lunchtime speaker, and then breakouts. And the breakouts are usually done by disease as well as survivorship topics. So what we'll do is present half the diseases in the morning along with the survivorship programs, and then flip them so that in the second half of the day, the other disease breakouts are presented, and the people that went to their disease in the morning can now go to the survivorship topics, just to make sure that everybody gets a chance. When we have lunch, we usually have lunch set up so that people can sit with others with a similar diagnosis or treatment. We also do other regional programs, small ones, mostly in secondary markets where people can't get to the blood cancer conferences. We then have our national program. So every month, there is another national webinar, very often on diseases, but sometimes they're more general, say on side effects management, or in February, we have a CAR-T program, as well as one that's on new therapies across the board for blood cancer conferences. And those, once they're presented, usually within a week or so, sometimes sooner, you'll see the transcripts will go up right away, and then we'll check and make sure that the recording, as long as we didn't have any ambulances in the background or something like that that gets in the middle of it, you can listen to the webcasts online as well. We also have podcasts. So podcasts are basically, exactly what they are. I'm sure you've all listened to podcasts at some time or another. They are hosted by 2 of the education staff. And with our podcast, what we try to do, depending on the topic, is if we can have a key opinion leader talk about, say, again, on a specific disease, but then bring in a patient or a caregiver so that we can see their perspective on that same topic. There are a lot of different topics there. If you go to the link there where the podcasts are, you will see also that it's divided by topic, and you can find information on all of the different podcasts that we've had. We also have vodcasts, so video podcast, and that's called our Hematology Horizons. And with that, we've done a little differently. So those are more, what we've tried to do is send staff to various different conferences so that you can kind of get the feel of being at the conference. And then this way, they'll then talk to some expert about the topic that's related to the conference. We just did a couple of them at the ASH, at the American Society of Hematology meeting in December. And we did it focused on information for patients as opposed to professionals. And then again, loads of educational videos, ranging from in-person videos, real people videos, to those that are done with more animated information and stuff. And you can see things about, lab tests and different types of treatment and things like that. And then this is just some information on some particular population-focused programs we have. We have our Dare to Dream, which is all part of our children's initiative. And part of that is our Trish Green Back to School program, where we work with the schools and the parents to make sure that the transition from the hospital back to school is as smooth as possible. And part of that is continuing education for nurses and social workers and teachers, as well as a recent school guide for the educators for when the child is coming back. We also have our Myeloma Link program in African American communities. We know that at least one of the diseases, multiple myeloma, there is a higher incidence of myeloma in American and Black Americans. So we have gone into the communities to really make sure that they're aware of the disease and educate them about not only the disease and the treatment, but also the resources that are available to them. And then similarly with outreach in Hispanic communities, making sure that we're getting to those communities of people where English is not their main language, and making sure that they know what services are available. And then lastly, our financial support. So as you can see here, we have a number of financial support programs, as well as something that we started this year, our medical debt case management. We do not give you money to get rid of your medical debt, but we work with a number of other resources to help you navigate through that medical debt and how to get rid of it and minimize it as much as possible. And again, a number of the financial support services are here. It's always good to check because we never know when one is closing, but then opening again, and it's all dependent on the resources that are available. So as you can see, everything just kind of comes full circle. All of these groups work together to make sure that we're servicing the patients and their families to the best of our ability, and always creating new resources and new support programs enabled to do that. And with that, I want to thank you for your attention, and I'm going to stop sharing. Linda, I'll turn it back over to you.
Thank you, Karen. I'm looking to see if we have any questions. Anybody want to have any questions? You can submit it on the Q&A.
I guess I did a great job.
You did an awesome job. Yes, ma'am. So with that said, then Karen, thank you so much for a great presentation. And so thank you all for being here. This concludes the presentation for today. And if anyone has any questions, please contact ECD Global Alliance.